All right, so I'm the bureaucrat person who's going to talk about New South Wales Health. So I need my ego boosting. No, I'm only having a joke, James. But I've only been with the network for 5 years, so I sort of constructed this talk from looking at some records of the last 15 years, and so things may be a little bit askew, but hopefully I've captured it. And I will talk a little bit about quality as well. So I just want to acknowledge the traditional owners of the land that we work on, the Cammeraygal people of the Eora Nation, and pay our respects to elders past and present, and extend the respect to the Aboriginal people if there's any here today. So the BMT network currently spans over 15 BMT programs, that's stretching from Wollongong down to up to Newcastle, North Shore being the largest autologous transplant centre, but they also do unrelated and related allogeneic transplants, as you know. So I'm going to look at the last 15 years, and I was just looking at the numbers yesterday, and the transplant numbers have actually completely doubled in that time frame. So it is an evolving area. I'm going to look at the working groups that the network has, the quality management system, go through a few of the projects that we have and some of the priorities. And I'd just like to acknowledge before I start that the network is the network. It's not me, it's not my team, it's actually most of the people who are sitting out there, the doctors, the nurses, the pharmacists who contribute a lot to what we do. Okay, so just a bit of a summary of what the BMT network is involved in. We have BMT specific publications, some of the patient guides that you would have seen, model of care guidelines. We have a statewide quality system which encapsulates those 15 centres. We have network groups, which a lot of you are members of and big drivers of. We have some clinical guidelines, long-term follow-up being a very important guideline that's come out recently. We have an environmental cleaning program, looking at the wards and seeing how clean they are. We are very much involved in patient experience and conducting patient experience surveys. And we also have a very comprehensive education and training forum. So just looking at the network, we used to have a group called the Executive who looked over the network. It's sort of now called the Council, but it has the same idea. It's charged with the strategic direction of the network. As Chris has mentioned, there was an initiation of a statewide plan back in 2004, looking at the services and what was required, and I know he was very much involved in driving the changes to BMT across New South Wales. 2009, the enhancement funding came out from the government. I had governance on my mind, sorry about that. Came out from the government, and that was fundamental in getting some of the data managers and nursing staff, pharmacy, and also changing the outpatient services across New South Wales. And yeah, Chris was our chair from 2011 to 2015 and has been very much instrumental in making some of the changes that were necessary across the state. Two working groups that no longer exist but actually have been rolled into the council are the autologous and allogeneic working groups. And they produce some really good transplant protocols, which pretty much have informed all our documentation. That it covered everything from donor and recipient workup all the way through to collection and transplant and follow-up of those patients. So they were very big documents, sort of 80 to 100 pages, and I was having a look at them yesterday, very comprehensive. And I kind of wonder why we don't have them now, but they have been rolled into other documents. Other big pieces of work over the years has been a consensus guideline for rainy day harvests. It's basically backup harvests, studies into melphalan and plerixafor, and also, as I mentioned, the patient guides. We have one for autos and one for allogeneic. The AML model of care also is a big body of work, and there has been some rollout of that across the network. The allo group, we're very much looking at tissue typing and match unrelated transplants and looking at treatments for various complications. So Chris talked a little bit about the state plan, so I won't go on too much about it, but essentially some of the main recommendations were a strategy for long-term follow-up, benchmarking transplant outcome, so we've got somewhere with that. Formalising referrals of patients between centres, extra beds and services, which I think we've got. Some succession planning, and as Chris mentioned, North Shore moving to unrelated allo transplants in 2011. The long-term follow-up working group is driven by Professor Ian Kerridge, who's been very much a big driver of this area. They conducted a study into post-BMT survivors looking at transplants between 2002 and 2011, and that's really been fundamental in assessing the ongoing complications of transplants and identifying gaps that we need to plug. That led to clinical long-term follow-up guidelines, which came out in 2016, where we're looking at standardising patient screening and clinical care. And we've also got a new sort of idea, a co-design project, which we're actually running after this session tonight, where we're getting patients and clinicians together to try and work out sort of practical ways that we can improve the BMT journey. We've also been working with the BMT registry with Leonie, who'll be talking next, to catch additional clinical follow-up data. So hopefully we can get a better picture of complications and how we can address those. Nursing and apheresis group. See Cassandra there, she's been very much a big part of this. And David Collins, who was previously here, was very much a big part of running the education events and doing the introduction to haematology and stem cell transplantation education days. And they were very much part of the patient guides as well. Laboratory, Wei and Lily have been big drivers in the laboratory working group. Our big remit has been to standardise practice across the network. So we have 7 processing labs, and we want everybody to be doing similar processes and getting similar results. So we've been doing a lot of work on standardising how products are processed and stored. And as David Marr touched on a little bit earlier, quality control and quality assurance has been a very big part of what we've been involved in. And we've been looking at how good the products are by doing flow cytometry. So that's both at comparing to other centres in Australia, but also comparing against people in the network. We have a new group, the Pharmacy Users Group, PUG, which Julian Lindsay is the head of, and we see that as very much another fundamental area that's going to develop in the next few years. And that has been sort of a response to international requirements that pharmacy be part of the whole system. So quality system-wise, where did this come from? So essentially, there's national and international requirements for quality systems for laboratories. It started in 2007, the NPAC documents, and it was predominantly laboratory-based. And then from there, it moved to include apheresis, and apheresis centres got accredited in 2009. And then further on, the paediatric centres became accredited to international requirements, which are FACT requirements, in 2010. And as the journey goes, the requirements have got very much clinically based. We're now looking very much at patient outcome and patient experience. So what does this all mean? There's standardised documents and forms that are used across all the apheresis and clinical and lab areas. We have a pretty comprehensive internal audit schedule, which helps us demonstrate that we're meeting the requirements. We have standardised equipment, supplies and consumables, and we have a centralised way at investigating non-conformances. So if there's any changes to what people do compared to what the procedures say, they document that, and we have a look at that externally. So it's a secondary review to improvement. And then very much what BMT has been built on is validation of process. So a lot of the time we spend looking at published literature and seeing that certain aspects of collection, lab and clinical are meeting that literature. So that means the collection efficiency, so how well the product has actually been collected. Processing, we're looking at cell recovery, so when it's been processed and stored for maybe years and then taken out of the tank, that we're getting the cells that we need. And then the new part of what we're looking at more frequently is benchmark survival. So ABMTRR, the registry, have helped us with this, and we're able to compare how well people survive in one centre to another. Patient experience is very, very important, and Julie Stone from the network has been a big driver of this. We've now surveyed 600 patients over 2 rounds, looking at questions like, were you informed of the next step of your procedure? Were you introduced to your transplant team? Was it a clean environment? So the fairly general questions, and there's 5 of those, but we did find a very consistent performance across the whole of the 15 centres. We're now looking at a sort of more improved survey tool so that you can drill down, and potentially we could find some just local issues that we can put in some improvements. But across the board, it looks very healthy. There's been a lot of work done with immunisations. Dr. Eunice Liu from North Shore has been involved in that, looking at updating the vaccination guides to meet the Australian standards. We've now generated an immunisation card to be provided to patients that they can carry around to their various hospitals and clinics. And we've now very soon got a vaccination app, which will be a reminder system for patients to allow them to know when their vaccination is coming up. And they can also record when they've had their vaccinations. As mentioned before, the environmental cleaning's been a very important part of the network. We really want to make sure that the wards are clean and that any bugs don't flow onto any hospital-acquired infections. And we've conducted 5 audits since 2013 in that regard, predominantly outcome-based. So we've taken a white glove and gone to see if areas are clean. But it has come up with some interesting results. We, as a result, did some auditor training and cleaning training, and we've had a couple of cleaning forums which have been really popular. And it's good that we're supporting another group that have a really important part of the transplant journey. I've been involved in looking at the cleaning policy, and we're currently updating that, so I'm hoping that that'll be a better document in its next edition. So just a quick graph, because I'm a quality manager, I've got to put one in, just to quickly show that the environmental cleaning results and to see how we have improved. So in October 2013, the centres were below what the state wanted as for cleanliness, a 90% result. And you can clearly see that we've now gone above that fairly consistently. A couple of centres are sort of dropping down, but we will be continuing looking at these centres via audits, and we'll have another round next year. Educational events, we have a very comprehensive educational system. I think it's really important to say thank you here to all the staff who are involved in that, particularly North Shore. I know Ian's done about 5 of them, and presentations, and there's been several others who have been involved in this. So thank you. And yeah, we cover both the paediatrics sort of nursing, senior nursing, and laboratory clinical forums over the year. And our final brand new, straight off the press, is our network portal, or BMT Collaborative. It's very much a bureaucracy word, unfortunately, but it just came out yesterday, so people who are part of the network should have got an email. It has the added functionality of a forum, so people within the various working groups can discuss issues without sending reply all emails. Will have all our resources, so all our presentations, masterclass, education will be in there, and there's also a calendar to let you know when things are coming up. So I think that is something that people have been wanting for a while. It's a much more simplified version of what we've had in the past, and I think it'll be quite useful. So what are the next challenges? Well, there's expanding indications for transplant. Autoimmune transplants are already occurring, and that could expand in large way. There's definitely new types of products, so targeted T cells against certain cancers, and that's going to lead to new procedures and new documentation for us. We have new standards coming up, and we're ever complexed by the electronic medical record systems of the hospital and try to work out how we can keep adequate records to meet the standards. And of very big consequence is the need to address BMT survivors at a local and state level and continue to improve the system that we have around caring for those people. So in summary, thanks very much for North Shore for being a very big part of this journey. We've seen lots of initiatives in the area of BMT, and it's a very important area of medical science, and we've seen some great improvements, so hopefully that will